Hello, and welcome to CommonHealth, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Tracy Douglas, VCHA's CEO, and your host for this episode. On CommonHealth, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. Hello, listeners, and thank you once again for joining us here on our CommonHealth podcast, brought to you by the Virginia Community Healthcare Association. And I'm glad you have decided to join us again because once again, audience, we have a fantastic guest on here. And, you know, I always try and do our best to identify topics, real topics from real folks to bring to you. And although we do a lot of this, a lot of the topics that we get and the folks that we get come out of Virginia, I will say that this particular individual that we have brought on is actually not from the Virginia area. I believe he's from the North Carolina area. Okay.
That's correct.
Okay. But I really just feel that, you know, it's important that we have this conversation, listeners, so that you can be aware as you continue to focus on your health care, right? That you're able to make the best decisions that you can, given what you're given. As it pertains to climate. And yes, climate change does have an impact on our health. And so with that, we have got a very special guest, and who I have known for quite some time, Mr. Moneybags, but it is Ben Money who comes to us from the National Association of Community Health Centers. He's the Senior VP of Population Health there. And like I said, listeners, I have known Ben for many, many years, and he is a wealth of knowledge. But he has definitely taken a special interest in the climate and its impact on our health and everybody's health. And given that here at community health centers, not just in the Commonwealth of Virginia, but in all of the United States. He works with our national organization, and they are putting a special emphasis on climate change. So with that, I'd like to welcome Ben today to speak with me around climate change. So Ben, welcome.
Thank you, Tracy, and I appreciate the opportunity to speak with you. By the way, my maternal home is in Farmville, Virginia. It's about 100 and some odd miles north of where I currently live in the Raleigh area. And, you know, our climate is pretty similar. So what I'll speak to today really is kind of reflective of our region, right?
Right. Exactly. That's exactly right, Ben. And you know, Ben, before we get started in talking more around climate and climate change, can you talk to us a little bit about, you know, your background and you know, how you came in the community health center space?
Okay. Certainly will. So I've been working with NACHC for about 2.5 years, but prior to that, I spent 18 years with the North Carolina Community Health Center Association, the last 10 of which I was the CEO and president. I was appointed after 18 years with the PCA to be Deputy Secretary of Health in North Carolina, which I did from 2019 to 2021 during the COVID pandemic, where I oversaw public health, rural health, health services regulation, and minority health. Once we started getting vaccines in arms and the vaccine became more prevalent in the community, I accepted an invitation to go back to community health centers. With great pride, I saw the amazing work they did during the pandemic. I saw the essential nature of community health centers and serving particularly people that have been historically marginalized. And so I was glad to get back into the health center family and to assume my role at NAC, directing population health. How did I get involved in climate change? Is that something that is,
Mm-hmm.
you know,
Yep.
not necessarily congruent with what health centers do? Well, I would say it actually is,
Yep.
because the patients that our health centers serve are hit first and worst by the impacts of climate change. They live in often redline communities or communities that are disproportionately prone to flooding or other climate related impacts. Also, the folks we serve are least likely to be able to have adequate insurance, be they property owners or renters, to be able to cover any losses that they may incur. And they're also, and statistics have proven this, least likely to get the necessary resources from FEMA and other recovery agencies to make a full and whole recovery. You can even look
Yeah.
to individuals who were impacted by the Hurricane Katrina in New Orleans. Many of them are
Mm-hmm.
still displaced, and many of them still have financial as well as health and emotional impacts resulting from that disaster that occurred in 2005. And what we're seeing more and more
Mm-hmm.
of these disasters happening with a more frequent basis. So this year we're on pace to exceed $21 billion disasters across the United States. So 20 disasters, of which each one cost over $1 billion.
And you know what? It's interesting that you say that. And again, listeners, we'll get more into um, tying climate change with the impact on health. And but I do want to just say that I was talking to somebody who used to live in Florida,
Mm-hmm.
and she had told me that she had recently talked to who she no longer lives in Florida, had talked to a friend of hers who still lives in Florida, and that her friend had been notified by her insurance company that they're going to be pulling out of Florida because of the massive amount of climate change that's occurring with all the different hurricanes and the flooding. And speaking of the dollars, when you take a look at the dollars that are being expended in just a state like Florida, right? Um, you know, you get kind of concerned. And so that being said, you're right. We continue to hear more and more about how much this thing called climate change is impacting us, at least financially. But we're not here to really talk about that. What we're really here to talk about is how we can keep real people, right, healthy, despite what we're dealing with in our environment. And so, Ben, I want to just kind of share with our listeners some statistics, right? And
Sure.
we'll talk a little bit more about that. But listeners, one of the things we have to be cognizant on, whether we want to use the term climate change or not, this is what we have to be aware of. And that, a warmer climate is expected to increase the risk of illnesses and death from extreme heat and poor air quality.
Mm-hmm.
Also, we know that climate change will likely increase the frequency and strength of extreme events such as floods, droughts, and storms that threaten human health and safety, just like you were just talking about, Ben. Also, climate changes may expose more people to diseases, right? And some of our most vulnerable patients, like our elderly as well as our younguns, really are vulnerable to the health impacts. But in 2016, the U.S. Global Change Research Program produced a report that analyzed the impacts of global climate change on human health in the United States. And the report found these three I thought were really interesting, Ben. One was that climate change is a significant threat to the health of the American people. Two, climate change can affect human health in two main ways. First, by changing the severity or frequency of health problems that are already affected by climate or weather factors. That I really thought was interesting. And second, by creating unprecedented or unanticipated health problems or health threats in places or times of the year where they have not previously occurred. And then, third bullet here, they talk about how every American is vulnerable to the health impacts associated with climate change, but some populations will be especially affected. These groups include, like you said, Ben, the poor, some communities of color, limited English proficiency, and immigrant groups, indigenous people, children and pregnant women, older adults, vulnerable occupational groups, people with disabilities, and people with extreme medical conditions. And I really was drawn to that those statistics, Ben. And so with that said, my question to you is, we heard as to why you have an interest in this, but tell me why a national organization like NACC, the National Association of Community Health Centers, why are they so particularly interested now in climate change?
Well, first of all, we support our community health centers. They're on the front lines serving um, the most vulnerable people across the country. So our emphasis is really on assuring that they have the resources to be able to meet the needs of their patients. And it's been clear, as you stated, that the impacts of climate change do disproportionately impact the patients that health centers serve. And we also know that a significant portion of the populations health centers serve are individuals that are housing insecure, or they're
Mm-hmm.
work in occupations that increase their exposure to heat, or they're in a situation in which they may not have adequate utilities or resources to afford air conditioning. So, as we've seen, the largest climate related death event take place, and that is extreme heat throughout this country over the last 3 to 5 years, we recognize that it's those individuals that are economically vulnerable that are at greater risk. Giving an example, there is an early onset kidney condition that can occur that would leave a young, otherwise healthy individual in need of dialysis or a kidney transplant simply because of frequent exposure to extreme heat in working conditions. And that kidney condition was
Mm.
first identified in the sugar canes in Central America, but now we're starting to see it in the United States as well. We also know of, and we saw it this summer, um, folks that worked outside actually having heat stroke and being
Mm-hmm.
hospitalized or even succumbing to heat. So, heat, while it doesn't often show up in those lists of named disasters, is actually the largest climate related killer of all events. So that's one thing. I think the other thing is health centers themselves are uniquely vulnerable as facilities. So one of the things that we learned from the events in 2017 in Hurricane Maria in Puerto Rico is that without electricity, health centers cannot provide the care to patients in their communities. We depend so much on
Mm.
refrigeration of vaccines and other medical supplies. We depend on electricity for electronic medical records, for medical devices, frankly, just to keep the lights on and provide care. That without electricity, health centers, are pretty much down for the count. So, taking that experience from Hurricane Maria, as well as the efforts that an organization called Direct Relief implemented in North Carolina, we've embarked upon a project to really replicate this solar microgrid installation effort of Direct Relief, where they installed solar panels, battery backup systems, tied to their health centers' existing generation systems to allow health centers to be up and operational if the power goes out, so that they can be self-reliant, not tied to the grid, not tied to a dependence on power being constantly on, that even if the power is interrupted for a short period of time or a long period of time, these health centers can have their lights on, the EMR operating, their refrigeration, keeping the vaccines, other supplies cool, and they can be up and operational. So NAC, along with Capital Link and an organization called Collective Energy, which is a spinoff of Direct Relief, actually formed the Charge Partnership, which stands for providing continuous health access to clean and resilient green energy. And that initiative is really focused on assuring that health centers can have these solar microgrids at least one site of every organization so that they can be up and operational and resilient in times of power outages, and that they can help to control their utility costs and be able to have the ability to take any savings and reinvest it into the delivery of healthcare. So it's an effort to provide continuous power, to create resilience, to have a cost savings, but also it's a mitigation effort because the energy that health centers generate from the sun and save in their batteries is less fossil fuel generated electricity that's produced on the grid that they would be consuming.
So Ben, I'm sorry, but I want to just kind of pause there for a second.
Yeah.
So this solar microgrid program,
Mm-hmm.
what a interesting and fascinating program. And so how can community health centers learn more about this? Where can they go to learn more about this? Because I can't imagine that health centers here in the Commonwealth of Virginia, as well as in other states, wouldn't want to know more about this program, given where we are with addressing climate change.
Yeah, so probably the easiest place to go is to the chargepartnership.org website. So chargepartnership.org. Also on the NAC website under environmental health, we have resources that tie back to the Charge Partnership. And then Capital Link on their website actually has a white paper on the concept of solar microgrids in health centers and actually provides some examples of health centers with these systems and how it's beneficial to their overall operations as well as their ability to be resilient.
As we talk more about our community health centers and what they can do, right, to help provide, continue to provide the care to their community population, given some of the environmental stressors that we're talking about today. What are some of the other things that you see community health centers, as well as maybe other providers, partners with community health centers, what are they also doing to help address some of the issues around climate change that you're aware of?
So there's one large initiative that's actually taken place through the White House. It's the president's
Mm.
health sector climate pledge, which is actually an effort to encourage and support the health sector to decarbonize, to reduce their greenhouse gas emissions, as well as to reduce the use of products and practices that actually lead to excess consumption, plastic utilization, waste, excess water usage. There's a whole host of strategies that healthcare can employ to become more ecologically friendly, so that we know that the harm that we've done to the environment, and particularly to the air and water quality, has had disproportionate impact on human health, and it really is incumbent upon the healthcare sector to step forward and make the necessary changes that we know are technically feasible, cost effective, and practical to be able to reduce the harm that healthcare itself creates in our society and in our environment. healthcare as a sector generates 8.5% of all the greenhouse gases. And the United States really leads the way
Mm.
in terms of that. And not only, greenhouse gases in terms of fossil fuel generation for electricity, but particularly when you think about hospitals and surgical centers, the use of some gases that actually have a harmful effect on the ozone layer. So healthcare is really looking at how can some of those gases be recaptured rather than being, solely released in the atmosphere. And then also looking at alternative means of anesthesia and other uses.
Mm. So um, this show, listeners, as you know, we don't make this a political show. This really is about how we can best bring real words from real people here from Virginia to you all. So in hopes that it would maybe make a difference in your life. But I do want to just ask a question here, Ben. Why do you think that one, there are many folks who are skeptical about this thing we call climate change, right? But then also, why do you think it's taken us so long as healthcare providers, right, to really say, you know what, we've really got to look at this more closely?
Yeah, well, I think to your first question, it really boils down to economics. And the industries that have benefited from polluting our atmosphere are reluctant to change their business model. So they have been very active in uh, crafting a narrative, a false narrative, that climate change is far off in the distance, that it's not occurring now, that fossil fuel generation doesn't have a factor in accelerating climate change. Uh, and also that their industry is somehow clean and green. I'll use, and they've been very crafty in crafting this narrative. You know, one of the things that you hear often is this moniker, clean natural gas, clean natural and gas. Well, it's invisible, but it's not clean. And it contributes to greenhouse gas production that increases the heat on our planet. But tying the term clean and natural seems to make people feel like it's a good thing, when in reality, that natural gas, is harmful. So, and then there's also been really an effort to distract people from what they currently are now able to really see more clearly. It's hard to argue with the fact that our days are getting hotter. We saw places that had never seen triple digit temperatures have it on a frequent basis. Think about Siberia, north of the Arctic Circle, where the polar bears roam, having temperatures that are over 100 degrees Fahrenheit. We also saw that in the Pacific Northwest. And these are places, particularly Pacific Northwest, upper portions of the United States, Maine, even parts of Alaska, where people don't have air conditioning in their homes because they never needed it. They may have a fan, but not air conditioning for the most part. And so having these kind of extreme weather events, it's really hard to argue that climate change is not occurring. And then you just look at some of the graphs of the rise in, for example, this summer, sea level temperatures. Yet sea ocean temperatures in Florida were over 100 degrees. That's the temperature of the water. So coral was dying, fish were dying. Um, those are hard things to argue against. And then we think about just the latter part of this summer. Who would have thought going into the summer that we would have a hurricane in California, that we would have massive floods in Vermont, and that we would have a horrific wildfire in Maui that wiped out half of the island and killed, hundreds of people. These are the kind of uncommon events that really point specifically to climate change. The other thing is, you talked about the health related impacts. We were experiencing, I say we, our region, experienced the poor air quality that was a result of wildfires in Canada that were caused because of drought conditions there. That poor air quality came all the way down in Virginia, came down into North Carolina, and we had very many days this summer where it was a poor air quality day and people were advised to stay indoors. And those that obviously can't stay indoors are people that are unhoused, that work outside, or that have to commute to jobs where they're exposed to this poor air quality. And you couple that with, exhaust emissions and other fossil fuel burning in our own area, and that exacerbates the health conditions of pregnant women, of the elderly, of children, people with asthma, people with chronic kidney disease, individuals that are pregnant. All those folks are at risk. And for the most part, those are also individuals that had the least to do with the creation of the problem. They're the ones that suffer the
Hmm.
harm.
Hmm. Yeah, one of the other things, listeners, that I learned in a past conversation I had had with Ben a couple of months ago when he and I were at a conference together, but then also me doing a little bit of research coming off my conversation with Ben. But exposure to extreme heat can lead to heat stroke and dehydration, as well as cardiovascular, respiratory, and cerebral vascular disease,
Mm-hmm.
right? It says here excessive heat is more likely to affect populations in the northern latitudes, like you talked about, Ben, right? Where people are less prepared to cope with excessive temperatures, right? And it says certain types of populations are also more vulnerable than others. For example, outdoor workers, student athletes, and homeless people, which we have community health centers that predominantly focus on the homeless, unhoused population, right? That they tend to be more exposed to extreme heat because they spend more time outdoors. And low income households, right, and older adults may lack the access to the air conditioning, right? You talked about the air conditioning, which also increases that exposure to extreme heat. And then it said here that young children, pregnant women, older adults, and people with certain medical conditions are less able to regulate their body temperatures
Mm-hmm.
and can therefore be more vulnerable to extreme heat. So, Ben, why do we care? Why do we have to care about this?
Well, because that's what we do. That's what we do. The people that come through our doors at community health centers are being impacted by this every day. And we can't simply just treat the problem. We need to be actively involved in addressing the cause and really being part of a broader coalition of healthcare organizations. And the majority of healthcare organizations now have really signed on to the pressing need to address the root causes of climate change, because it is our number one public health threat. It is an existential threat to
Mm,
humanity. And we think about the fact that there are several irreversible tipping points that will occur during the course of our lifetimes. In fact, some of those impacts are slated for 2035. If you looked at that data from 2016, it would say that those would occur in 2050. Well,
mm,
the estimates that have been derived from international bodies of researchers that look at the science have tended to be conservative estimates. What we're seeing now is really a rapid acceleration of the tipping points of climate change. And in fact, we now, as a planet, are burning more fossil fuels than we ever have in the history of mankind. So, this is
Mm.
called the anthropogenic era. This is the era where mankind is impacting the viability of the planet. That era actually occurred like right after World War II in the massive industrial era, where you saw a rapid rise in the use of automobiles as a mode of transportation, growth across the world that was really fueled by fossil fuels. So fossil fuels have kind of built the economy and the civilization that we currently have. But it's also those fossil fuels that are going to destroy us if we don't stop now with the use of fossil fuels and really transition to energy that truly is clean. Um, Renewables
Mm.
such as solar and wind, and geothermal. It's by very nature essential that we arrest the cause of the threat to human health, which is greenhouse gas reduction. So that's why energy and the transition to clean energy is a public health priority.
So, what can we heard, Ben, what the National Association of Community Health Centers is doing to put some focus on climate change, and we also heard of an example that you had talked about coming out of the Biden administration, a program. But what can some local communities do
hmm
to
So,
help address some of these issues?
yeah, so one of the things that they can really do is understand what their local risks are. What are the climate impacts to their community, and how is that affecting the patients they serve? Last year and continuing this year, NAC has partnered with the Harvard School of Public Health and with the Migrant Clinicians Network to develop a learning collaborative of community health centers really focused on preparing their clinicians, their patients, and their organizations for the specific health related impacts of climate change, focusing on extreme heat, on the impact of wildfires, and then weather-related events of flooding and hurricanes. And this toolkit is actually available through the AmeriCares website. They just announced today the launch of a new learning collaborative that they're hosting. We will be hosting another one in the late winter, early spring of 2024. But the whole effort is really around to get this toolkit, the strategies, and the resources in the hands of actual clinicians and
Mm.
clinical staff and administrative staff to test out the strategies, the tools, the educational materials, to use that to refine the process, to continually improve it, and then to spread it out to additional health centers.
Mm. Okay. Well, um, listeners, we can certainly have another hour's worth of conversation with Ben because there's still so much that sits in his brain, that he could certainly share with us when it comes to this. And Ben, so the reason why I put that out there is because I just want you to know you will be back. So
I
we
look
will be
forward to
pinning
it.
you down. Awesome. But we do extend an appreciation for you coming and talking to us a little bit about the impact of climate change on someone's health, and then the kind of things that we're doing here at community health centers
Yeah.
as
Yeah.
we look to address that. Because at the end of the day, we all care about our health,
We
right?
do.
We all care about our health, and so we want to do everything we can to bring as much information out to individuals so that they can be cognizant of their environment. And so,
Yeah.
Ben, we need to have you back here. So will you
Oh,
come
sure.
back?
I will, because we didn't get a chance to talk about drought or vector-borne diseases or water-related illnesses or the food
That's
and
right.
safety, nutrition aspect of climate change and environmental health. We didn't talk about mental health and the impact to people in terms of stress. There's so much we can talk about, and I really look forward to our next conversation, Tracy.
Awesome. Ben, thank you for your time. And listeners,
Thank you.
Ben will be back, and we look forward to bringing Ben back. Thank you. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit subscribe button and share it with others on social media. Leave a rating and review or visit our website at www.vcha.org. This is Tracy Douglas Wheeler, and thank you again, and I'll see you next time.